Good morning, everyone. I am not a morning person, so I'm just warning you. I've had some caffeine, so I'm hoping that will help me to show my exuberant self. But I'm pleased to be here before you. I'm a program officer at the Patient-Centered Outcomes Research Institute, PCORI. There's a crew of PCORI folks over there. Some of whom I think you'll hear from later today, talking about, yesterday I was here with one of my colleagues talking about strategies for developing patient-centered research questions. And then you'll hear from one of our, in a learning lab later today, about patient engagement in the process of research. So I'm basically going to tell you a bit about two programs that we have at PCORI in our engagement team that provide funding for communities so that we can help to shift that research paradigm to ensure that communities kind of have that voice and bring that voice to the table. And this allows the communities, particularly patients, to drive the research and then have data as the passenger. So I wanted to look at, some background. I can be very analytical about things, and so I decided to go to the definition. And looking at data, it's factual information such as measurements or statistics that allow people to make decisions. Particularly, health data allows people to make decisions that may be meaningful to them. But sometimes that data is crowded and needs to be refined. And so, one of the things that I saw was that data is the new oil. It is only useful when it's refined. And I think we're seeing right now how important refining of oil is with gas prices going up, particularly with the hurricanes and whatnot. But, I thought it was interesting to share with you just that you could have all this information, but unless it's really pertinent to communities, they're not really going to get any value out of it. And so that's one of the reasons why they need to be a part of driving the information that's collected that will then help them to make decisions on their healthcare. So at PCORI, our vision is that patients and the public have information that they can use to help make decisions that will reflect their desired health outcomes. So this means that, we are engaging patients, clinicians, and caregivers in the entire research process, from topic prioritization to proposal review with our merit review program, and then dissemination and implementation of results. The PCORI vocabulary includes many, many words, but one of the primary things you'll see here is patients and caregivers because we value that perspective that comes from them. And at PCORI, we fund research that focuses on clinical effectiveness, comparative effectiveness research, focusing on two treatments or diagnostic tools that, basically comparing two treatments or two diagnostic tools to help patients to figure out which one will work better for them. So a patient may have these questions of which one should I choose and what will happen to me if I take this medication? What are my options or the potential benefits and harms of those treatments or diagnostic tools? What can I do to improve the outcomes that are most important to me? And how can clinicians and care delivery systems work together to help me make better decisions about my health? At PCORI, we have two funding programs that I mentioned earlier. You heard from Regina about her experience as a Eugene Washington Engagement Award recipient. I think we may have a number of recipients in the room. Can you all raise your hands? All right. So I don't know, I don't necessarily need to go too into detail about that, but basically these are awards that support projects that bring together communities, including patients, caregivers, and clinicians, and it allows them an entree into the research world. So in some cases, we've had projects where people have focused on informing and training and developing communities. You heard from Regina about her experience with Pastors for PCOR, and our other panelist, Dr. Tobin, is also a part of a Eugene Washington Engagement Award. And then also I am a program officer for the Pipeline of Proposal Awards, where we are working to build a national community of patient stakeholders and research partnerships that have the expertise and the drive and the passion to involve their communities in the research development process. And I wanted to also share with you that sometimes it's important to think out of the box in terms of what data means to communities, and then how you can get that data from communities and engage those communities as well. And so we have some examples here of projects where patients have driven the data and the development of a research study. We've had a project that is based in New Jersey with a focus on sickle cell anemia, and they've done some outreach via Facebook and through support groups in order to engage the folks and identify what data is important to them. Many of them have identified that their biggest issue is dealing with pain, and then the medication that they must take in order to deal with that pain and how it's then impacting the rest of their lives. We have a project that is called Cystic Life. It's focusing on cystic fibrosis and looking at cardiovascular exercise as a treatment option. And that's a patient-led project. And they primarily engage their community electronically through message boards, through blog posts, as well as through Twitter. We have another project that is focusing on melanoma research called Soul Survivors. It started as kind of like a patient support system for those with melanoma. It was started by, this project was started by a young 20-something female who realized that, she might be considered an anomaly where she's not going out to tan and she's got to put on her big hat. But she realized that as a patient, she had the information that researchers might need in order to really direct that research. And she shared several stories, particularly about her experience at Oregon Health Sciences University and knocking on doors to find the right person to partner with. And she recognized that in opening, her funding from PCORI is one of the things that really allowed her to have the doors open to her, because she came with the money. And researchers were really intent on hearing from her and getting an idea of, as a patient, what is your perspective? What should we be focusing on? Should we be focusing on prevention? Should we be focusing on treatment? And then we also have a project, it's #LCSM, and the main focus of that project is lung cancer and lung cancer treatment after surgery. And it's a clinician-led project where the project lead kind of sourced his research question as well as some data from using a Twitter chat. And I just wanted to give you a sense of some of the projects that we funded, and then also understand that you don't necessarily need to use registries. There are other methods by which you can gain access to the community as well as gain data from them. So it can include, as I mentioned, message boards, Twitter chats, Facebook, town halls, world cafes, surveys, and conferences. But there's no cookie cutter approach, and it's important to know your community and have an understanding of what it is they value, what's important to them, and how you can work together to then determine what that research should be. And just wanted to share this with you. You'll see in the middle of the PCORI research process, but at the beginning, at the pre-planning stage, before you've really truly developed what your research project will be, when you work with the community in capacity building, and before you sometimes even have that research question in place, you are more likely, it's been shown that it's more likely that the patients and the community partners will be more engaged in the research process, and will help you to disseminate and participate in the implementation of your study findings. And just to leave you with a thought, where data can really sit as that passenger as patients drive this information. If the data system isn't reflecting the full patient experience of living with a specific health issue, then is that data system fully integrated if it doesn't have that patient perspective? And so I would say no. And in that case, that's why I think that data while is very important, and it will help to drive that research, it really kind of needs to take a seat on the passenger side. And when you think about the impact that your research will have on your community, you need to make sure that their voice is integrated into the system, into the process, and ensuring that what it is that you're doing will actually improve their health and give them options and really integrate them in the process. Thank you.